Hey beautiful people, today we are doing our second PRP. The scar it's reducing is the same client, so that is numbing cream we are applying so that she will not feel pain. Yeah, so that it can ease while performing the PRP. So we have applied the numbing cream. We will leave it for like 30 minutes so that she cannot feel pain while we are using the microneedling machine. Yeah, so that is just a foil paper added to it, covering paper. Yeah, then we'll give it some time, like 30 minutes for it to work until at least when you are pressing her forehead, you should not feel some pain. Though there is that psychological fear that one can have that can make you feel pain even when it's not painful. Yeah, it's now ready. That is after 30 minutes later. We have wiped the numbing cream, we have cleansed it a little bit. We are starting. So this is the serum, the plasma, not the serum, the plasma, because it was collected in sodium citrate vacutainer tube, then centrifuge the blood and remain with the plasma. So the last time I showed you how we collect blood, then we centrifuge and take the plasma. So this time I just decided to show you the plasma directly. So this is the microneedling machine that it's being used to do the PRP, so that it can enable, it has a small needle, at least it enables the plasma to enter inside the scar. So there it is. Yeah. The machine, it has like you can change the position of the needles. So you can start with the easier one that does not go too deep, then increase with time. Yep. So we're just trying to make sure the plasma, it has entered inside the scar, because your own proteins, it really helps in healing the wound. So, and the plasma has the fibrinogen part of it. Yeah. So there it is. You can see. And today there is less bleeding, unlike last time. The scar, it was hard. The skin was hard, so it had too much bleeding. It was like you were torturing the place, the scar. Like it's like we're torturing the patient. But today it was easy, not painful at all, no too much bleeding. As you can see, the other time there was too much bleeding. That's why I did not show you this part, because it had too much bleeding. I just told you we did the PRP and I showed the end results, but today there was not too much bleeding. Yeah, because the other time it had too much bleeding, maybe it could make some people even not to watch. You know, some people, they don't like seeing blood. Yeah, so you can see. There it is. Yeah, so it is swelling a little bit because we have interfered with the skin. So there is that machine, it has some small needle that they're not reusable. You fix a new one in every client. So once these ones that are being used here, we are done with them, it will be thrown. For the next client, you're going to use new ones. Yeah. So at the end of this microneedling machine, there is a place where you place the needle part. That part, this part that has the small needles, it is replaceable. So once you're done with the procedure, you're going to throw it away, so that in the next client we'll have new needles. We don't share the needles. Like, you know, one can ask, why are you using the same machine? The machine is the same, but the needles are different. You replace with a different needle for the purpose of safety. And yeah, So it's not like we're using the same machine, the same needle for every person. No. Once we are done, these needles are going to be thrown outside in the sharp box. Then we will replace with new ones at the moment they're doing for another client. So we're expecting after 4 sessions the scar to have faded, because as you can see, if you saw the first scar, it was kind of big. It is reducing, and we're so happy. We're so happy for her. She'll have a good face, a clear face. So for those who have subscribed, thank you so much. For those who have not subscribed, currently subscribe. Yeah, have a happy 2024. Happy New Year. Yeah, let's start with this video. Our new year. We are ending the year and also starting a new year with this video. So we collected too much serum, too much plasma, because the blue top, which is sodium citrate, we had poured too much. Like it was almost full up to the blue mark. So we centrifuged and the plasma was too much. So we had to, use all of it to ensure all of it is used. Yeah. She had some other marks around the face. That's maybe the remaining. We can use it in those